Hello. When we talk about students requiring a supplemental or intensive level of support within a multi-tiered system of support, or MTSS, we also realize that the level and types of student assessment used may intensify. Although many pieces of data gathered through a universal screening system can help us to identify who is at risk, and an initial supplemental standard treatment protocol to match them to, further assessment is needed to know if they are responding, and if not, what else we may need to do. Answering that what else we need to do is where diagnostic processes come in. Those will be covered in another video. For now, we will talk a little bit about monitoring progress for students receiving intervention, or more accurately, monitoring the progress of the instruction we are providing. To accompany this video, please refer to page 8 in the MTSS Assessment Guidelines. This video is not meant to replace a thorough read of these guidelines, but only to explain some of the key points in this guidance and our rationale. So first off, let's talk about why. Why should we progress monitor interventions? The first reason is to ensure the effectiveness of the intervention. This is not done by just attending to individual student data, but instead examining data on all students receiving the same intervention to ensure that most students are responding to the intervention. If most students are not responding to the intervention, then no individual student should be identified as a non-responder until we can ensure that the instruction itself is effective. The general rule of thumb is that a supplemental intervention should result in positive outcomes, which means moving towards closing the gap, for about 75 to 80% of students receiving it. The second why, or reason for progress monitoring, is to measure student growth over time. Again, the purpose of intervention is to accelerate progress, to close gaps. Therefore, we should expect students to grow at a rate that will achieve this goal. Third, we progress monitor to inform instruction. Although some measures used in progress monitoring measure a wide range of skills and may not be discrete enough for educators to use in day-to-day instructional decision-making, we should be able to gather data regarding whether or not to continue on our instructional path or examine other ways to reach students. And finally, we progress monitor to measure how well students are responding to our instruction and intervention. Again, this should be at the individual and group level. Now for the what. Now that we've covered why we progress monitor, let's talk about what we will be using to progress monitor. An important point to make in this guidance is that we cannot make educational decisions about progress, growth, or response of students receiving intervention using any one measure. We must give equal weight to different measures and sources of data to determine these things. The measures we will cover here today and that are in the MTSS Assessment Guidelines to be included in a comprehensive progress monitoring matrix for students receiving intervention are curriculum-based measures. Examples of these include Dibble's Next, AIMSweb, EasyCBM. This may include mastery measures, which are curriculum-based measures, and general outcome measures. Also, computer adaptive testing. This is especially useful in the area of math to monitor student progress. The only caveat we would say is that caution needs to be used in this type of assessment with younger students. Intervention embedded assessments. These include mastery measures that monitor the progress of that intervention curriculum. These are usually included within that program, but they are an important piece of data to consider to ensure that students are internalizing the skills taught to them on a daily or weekly basis within the intervention program. Then, informal assessments and anecdotal data. This is an area that we often neglect, but these are assessments that are done throughout school, within the classroom and outside of the classroom. These are observations of student performance. These are performance samples that we obtain from students. And we must also pay attention to how students are performing on these informal assessments that educators give to ensure that their progress within an intervention is being generalized to the classroom. For the behavior and social emotional skill area, we can use things like checklists, daily behavior report cards, rating scales, structured observations, office discipline referral. This can all be used within behavior and social emotional interventions to measure their intervention progress. So, that's not a complete explanation of each of those measures. We would refer you back to the assessment guidelines, but that gives you some ideas of different measures that can be used to monitor progress of students receiving intervention. So now to the how. Within the assessment guidelines, you'll see a step-by-step process that can be followed to monitor students that are receiving interventions. The steps outlined are based in the comprehensive literature review that we've conducted as a state team about the current research on monitoring mainly academic interventions. Many of these steps are translated pretty easily into the area of behavioral interventions, but we'll be focusing more on academic intervention progress monitoring during this section. So before we begin the steps, we should note that traditional progress monitoring measures, such as CBM, are by design highly sensitive to incremental progress or growth of students over time. But because of this level of sensitivity, they also have lower levels of reliability. This is much like what we talk about with blood pressure. So when we talk about measuring someone's blood pressure, we never take one measure of blood pressure at one instance to make a determination about medication or lifestyle changes. Blood pressure is highly unreliable when you measure it once. When you measure it over time, multiple times, on multiple occasions, then we can start making some decisions based on the trend. And this is the same way about measures that we traditionally use to progress monitor. Due to these high levels of sensitivity, but lower levels of reliability, the current research indicates that we really need to attend to this by taking some precautions to make some sound decisions using these measures. Precautions which you'll see more of and hear more of within this video are using more data points across multiple measures over longer time periods than what we as practitioners used to be accustomed to. So let's get into the steps of progress monitoring. So the first step is always to determine what is the student's current level of performance. For some students, this could be their universal screening data, but for others that show they are significantly below grade level, this is typically 2 or more years below grade level, we want to conduct something called survey level assessment. Some people call this back testing. This is in order to find their instructional level. More information and complete guidance on survey level assessment is available, but for now let's talk about that once we use that survey level assessment and we find their instructional level, this is typically where they're functioning between about the 10th and 25th percentile. However, some measures, such as Dibble's Next, have their own procedures to find that student's instructional level, and we should always use the method that's matched to that assessment that you're using. For information on the progress monitoring using Dibble's Next, this is especially important for K-3 in North Carolina, but please refer to the link that's provided within the assessment guidelines. So let's take this through the lens of an imaginary student when we're finding that first step of conducting what it is to find where they're currently functioning. So let's say his name is Chris, and Chris is in the 4th grade, and on the universal screening measure used of oral reading fluency, his score placed him at about the 10th percentile compared to national norms. We know that Chris is significantly below grade level based on that data. So now we test back or conduct survey level assessment, and we find that in 2nd grade level material, his performance is at the 20th percentile. So we could probably say that 2nd grade would be his instructional level. Okay, so now that we found what that current level of performance is for our student, Let's go into selecting the measures we're going to use to measure progress. So again, we're going to select multiple measures to determine response, effectiveness, and also whether students are generalizing skills back to the classroom. Generally, these will include a measure that looks first at the skills being intervened upon. Okay, so this is the intervention focused. This could be a mastery measure. It could be an intervention embedded assessment. For Chris, our imaginary student, the team is using a standard reading intervention that includes a weekly measure of his progress through the intervention curriculum. Next, we'll also use a curriculum-based measure or a computer adaptive test at the student's grade level to ensure their generalization, and at their instructional level if they're monitored off grade level. We'll use the measure on their instructional level for graphing progress most frequently if they're off grade level. If a student's less than 2 years below grade level, the team may choose to only monitor on that grade level probe, but more than 2 years typically means you'll monitor most frequently at their instructional level, and this prevents frustration in the student and the educator. For the example of Chris, we know that he's significantly below grade level. So we would measure him about one time a month, using a 4th grade oral reading fluency probe because that's his assigned grade level. This would be infrequent. But more frequently, to make sure that he's progressing, we would use a 2nd grade oral reading fluency probe. And this would be what would be graphed with a trend line and an aim line and a goal set within that material because he's significantly below. Last, we would take into account other classroom tests in the area of concern, other teacher observations, and other anecdotal data that's already being collected to ensure that Chris is generalizing. In step 3, we will set a goal. So in goal setting, we can set a criterion referenced goal, a norm referenced goal, or a goal based on a rate of improvement. But the overall aim of the goal should be to close the gap. The team should use the method recommended by the assessment that's chosen. No matter the method, the goal should be set to achieve that level's grade level or benchmark expectations, but in an abbreviated timeline. For criterion referenced measures, these are things like Dibble's Next. This is typically the end of the year benchmark level. And for norm referenced measures, this is typically a percentile level that gets them into the average range compared to peers. 25th to 50th percentile is a good range. So if you are monitoring off grade level, you'll set the goal for the end of year expectations in that level of material you're monitoring in, but we're going to shorten the time to get there so that the student can grow more than 1 year's growth in a year's time. So let's take our Chris example and say we are monitoring him starting around October of his 4th grade school year, and we're monitoring him most frequently, remember, in our 2nd grade oral reading fluency assessment, 2nd grade because that's his instructional level. So, for graphing and the most frequent assessment, we're going to set his goal at the end of year benchmark in the oral reading fluency assessment in 2nd grade material, but we're going to shorten that time that we want him to get there. So, we'll probably say that we want him to get to that end of 2nd grade goal, but by January. So therefore, we'll be attaining hopefully that goal by January in the 2nd grade material, and then we can start monitoring him in that 3rd grade material. And again, set an end of 3rd grade goal, but abbreviate that time. Okay, if you're using a rate of improvement method to set goal, be aware that most times the end goal that you set using that method is going to be pretty much the same as using a criterion referenced or norm referenced method. But your rate of improvement can be used to check to see, is this realistic for the student? And is this enough growth for this student to close the gap? Because typically what we want to do is we want to set ambitious goals where the student's growth rate or their rate of improvement is going to be about 1.5 to 2 times what we would expect from other students. This is because the student already has a gap, so in order to accelerate their progress, their growth has to be faster. Okay, and now step 4. We're going to progress monitor frequently. As you'll see in the complete guidelines, for students monitored on grade level, remember these are students that are typically less than 2 years below grade level, they'll be monitored with a curriculum-based measure or a computer adaptive test about 1 to 2 times per month when they're receiving supplemental instruction, and maybe as frequently as once a week when they're receiving intensive instruction. These are the data that's graphed. This is for students that are not as far below grade level. You're going to graph that grade level CBM or computer adaptive test. In addition to the graph data, their progress is also monitored using those other measures of the skills of the intervention, like the mastery measures and the intervention embedded assessments. And also, again, informally through classroom instruction. For students that are monitored off grade level, remember those are typically students that are 2 or more years below grade level. They'll be measured most frequently using that curriculum-based measure that's on their instructional level. Think about Chris's 2nd grade oral reading fluency is where we start measuring him, which is about 1 to 2 times a month again for supplemental and about once a week for intensive. For these students, we'll also want about once a month to measure them using a curriculum-based measure or computer adaptive test on their grade level to make sure they're generalizing. So for Chris, think even though we're measuring him most frequently and graphing the data from that 2nd grade oral reading fluency assessment, we're also probably going to give him a 4th grade oral reading fluency measure about 1 time a month. And of course, again, for students that are far off grade level, we'll still be looking at the progress of the intervention skills through other measures and their overall progress through the less formal classroom measures as well. Finally, the last step, step 5, is making decisions regarding student progress. Remember that only some of the measures we have covered here can be represented in a traditional time series graph, the line graph that you see most often in progress monitoring. To represent data this way, it should be measures that are repeatable and represent the same skills and metrics over time. This is why CBM data is typically the most appropriate to represent on a time series graph. However, even if some data that you collect, like lots of data that we talked about here, is not graphed, we have to give equal weight to all pieces of data. As a wise person once said, don't let a graph take the place of common sense. However, when interpreting graphed student data, research has indicated that we should use standard practices. First, our current research is clear that the length of time rather than the number of data points should be used to begin looking at students' response. Yes, we need a certain number of data points in order to see if progress is being made, but data points alone mean very little if the student has not been given enough time with the instruction. So, for graph data, typically this is your curriculum-based measure or your computer adaptive testing that's being used the most frequently, we need to monitor for a minimum of 10 weeks before making decisions regarding student response. To decide if they are responding, we should calculate a trend line using a regression analysis, with ordinary least squares being the methodology most frequently used. And this should be calculated using about 7 to 10 data points. From this trend line, we'll decide, are students having a positive, negative, or questionable response? Of course, within this interpretation, we are always looking at the student within the context of the instruction they're provided. In other words, did other students respond? Is the student really an outlier compared to the group, or is his progress what other students are making? In addition to the graph data, which is that CBM or computer adaptive test, we also want to look less formally, but with the same amount of weight at the other data sources we've talked about. So we want that gap to be closing on other measures to show response. We want to see that the student is generalizing back to the classroom. Although this may be slow, we want to see that it is being generalized. And are they acquiring the skills in the intervention? So on those intervention embedded assessments and mastery measures, do we see that each week they are seeming to acquire those skills? This is not a black and white process. Measuring a student's response is an art and a science. We want to make sure that we're making good decisions for students and groups of students in order to proceed to close gaps for kids receiving intervention. I hope this has helped with your progress monitoring knowledge. Please don't hesitate to reach out with questions or concerns, and be sure to review the complete assessment guidelines for additional information regarding student assessment. Thank you.